Thank you, sir. Hari sir. Good evening, good afternoon, and good morning. This is the 1727th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. ARIF MASOOD. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English. And from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who miss the session can watch it again. You can subscribe the same without paying any money. You can share it with your friends, not only with homeopathic doctors and lovers, but also with the students and lovers of homeopathy. The purpose of this forum is to take homeopathy to every home around the world. And we are very happy to invite the guest of the day, introduce the guest of the day, Dr. ARIF MASOOD. Sir has completed MD in homeopathy and then PhD, and was the dean at Ananya College of Homeopathy, Kalai, Gandhinagar, Gujarat. And it was the former principal, Madhava Homeopathic Medical College, Gujarat. Sir has done a beautiful job as a uh, dean as well as the principal of the college, and has participated in several international seminars and has presented papers at national as well as international forums, and has won many awards also. I have no time to discuss about all these things because sir is a big personality and will be discussing about a very, very important aspect of homeopathy, that is use of artificial intelligence in medical education. This is one of the recent subject, a very, very relevant subject also. Several people have presented such papers here. So let us hear and see what Dr. Arif sir has to say about this. We proudly welcome you, sir. Proudly welcome. You can begin the session, sir.
Okay. Good evening, Dr. Dinesh. I'm audible?
Yes, sir.
Okay. And I'm grateful, especially grateful to Sani sir for inviting me for this lecture. And also grateful to you also, Dr. Dinesh. So uh, I've chosen this topic out of my curiosity also, because nowadays there is an AI revolution going on in almost every scope of the world. If you see, AI is revolutionizing everything, whether it is medical education, whether it is treating patients, whether it is anything, wherever you go, you will hear the word AI, and that AI revolution is impacting the life of everybody. So I worked on this, and I have put up some studies on this. I have done a Harvard diploma in AI, how to use AI in medical education. So collectively, I'm presenting this. Hope this enlightens the knowledge of our homeopath, and they use AI in their coming lectures and in their educations. So let's begin. I'll be sharing the screen with you. So
It's fine, sir.
use,
Right.
yeah, fine, yeah. Use of AI in medical education are revolutionizing learning and training. Why I have chosen, I quite don't know how many persons are there and how many of them are in education. But the thing is, we at homeopathy are also being revolutionized by the NCH, and they have come up with many curriculums in which CBDC has been newly been introduced. Now, getting into this use of CBDC, so I hope this use of AI will enrich the knowledge of these teachers. Also, I'll try to present here that it's not only the teaching that we are focusing. Today, what we will be seeing is here. So my today's focus will be, what we'll do is we'll see what is artificial intelligence. We shortly what we say is AI, types of artificial intelligence, AI powered personalized learning pathways, virtual patients and simulation based training, current application of AI driven simulation and training, ethical and practical challenges in AI in medical education, future outlook and research directions, and what should be the recommendations for the educators. These are the points which I hope I'll try to complete in 1 hour or so. And then after that, we'll have a question answers session. So let's begin. What is AI? AI definition, there are many definitions to it. AI means simulating human intelligence in machine. That is creating a machine which has a similar intelligence that of an human. What is the purpose? The purpose is to enhance automation and problem solving in various fields. Now, I've written here various field. I would say in every fields now. Capability, machines are programmed to think, learn, and decide. This has already been completed. Every machine now, AI machine, can program itself, think accordingly, learn, and make a decision on its own. Relevance, AI forms the foundation for innovation in education and healthcare. So I'll be focusing on all the four aspects here, that what was the purpose, what is the capability, and what is the relevance here. As we all know now, when we are talking about AI, it's like a new generation coming, and I see old homeopaths and old teachers even are getting afraid of the word AI and how to use it. Like if I remember 10 years from now or 15 years from now, using of the mobile was a bit difficult for the older staffs and old generation. But nevertheless, now it's become a part of the daily routine of everybody. Without it, you cannot live. It's like I usually term this to the students as it is a part of the oxygen that we are breathing for the students and for the teachers now. So similarly, what I predict, AI is going to be the same. Using AI in every field would be the similar way like what we are using the tool as mobile. So coming up, what are the types of artificial intelligence? So actually, when you are talking about artificial intelligence and understanding types of artificial intelligence, this needs around 2 or 3 hours of lecturing. So it would be possible here. So I'm just summarizing this, that what are the types of artificial intelligence? It can be broadly given up into two: narrow AI and general AI. Now, what is narrow? Narrow, also called as weak AI, designed to perform a specific task such as image recognition or a language translation. This is a very weak AI. If you remember a few years back, we used to have a Google photo in which if you search for the photo, it would recognize and give us similar result. Similarly, few years back, Google also had a language translation, which has now been vast and widened so much. So this is just a small, weak AI. Second type is general AI, also known as the strong AI. This type of AI has the ability to understand, learn, and apply knowledge across a wide range of tasks at human level intelligence. Now, the difference between narrow and general is it learns from its own. It has an understanding and it applies its own knowledge to it. This is the vast difference between narrow and general AI. You would be surprised that most of our mobiles, whether it's right now or say previously 5 years back, already had a weak AI installed in it, what we are using. So these are the two. Again, there is a broad classification we can classify it one on the basis of capability, which already I told you, narrow AI and general AI. Narrow AI designed for specific tasks. Example, we had Siri, Alexa, Google Translate, facial recognition system. Now, the current status is most existing AI systems fall under this category, but they have developed into general AI or super AI. Second type is general AI, that is strong AI that can understand, learn, and apply knowledge across a wide range of tasks at human level intelligence. Examples are hypothetical at this stage, but no real world example can be said. But we can say Chat GPT, which you must have heard, OpenAI, they are examples of that. The goal was to mimic human recognition abilities, no, cognitive abilities. The third is super AI that surpasses human intelligence in all aspects, decision making, creativity, even emotions, etc. Now, this is purely theoretical or it is futuristic, but it is in the making. We cannot deny that super AI will not come in the future. This is one fear which most of the societies or most of the humans are also fearing, that if a super AI comes up, the humans will not be able to work with it. But that is just a possibility. It is into the making. If it comes, we will see what will be its impact. Now, based on functionalities, we have divided into four types of AI. Now, reactive machine, basic AI that reacts to current inputs, no memory or past experience are used. That means it is a machine where you just put up a few questions and then it answers depending upon that. The IBM Deep Blue chess playing computer was based on that, was I was saying. Now it has improved. If you remember, if you had played chess 5 or 6 years back, it was a reactive machine on which it was built. Then limited memory, can use past data or experience for a short time. Most modern AI systems fall here. Like examples, self-driving cars, chatbots, and recommendation system. You know now Tesla car, even Mahindra cars, they are starting to use this limited memories. The third is theory of mind. Still theoretical, again, AI would understand emotions, beliefs, thoughts, essentially stimulating human mental models. Now, I know this will sound scary, but it is in the process. And there are rumors that Elon Musk has already built it, but nevertheless, in coming time, it will come. The goal of it is to have a social intelligence and empathy in AI interaction. The fourth is self-aware AI, hypothetical AI with its own consciousness, self-awareness, and emotion. That means you can say a self-AI would be a human in its own self. Does not exist at the moment, but there are future plans to it. So based on the functionality, we have divided the AI into four. This is just a small um, my way of making the homeopath understand these are what are things going on in the present world and what we are going to see in the future. So on the basis, if you compare the basis two types on the capability and functionality, the based on capability, narrow AI has specific tasks like voice assistant or image recognition, which I already told you. General AI is hypothetical human level cognitive ability, while super AI is theoretical AI surpasses human intelligence. These are based on the capabilities. While based on functionality, we have reactive machine, simple response without memory, limited memory, uses recent data, common in self-driving cars, like I told you, Tesla cars. Then theory of mind, that is AI understands emotion. This is also theoretical. and self-aware AI. Now, this is hypothetical consciousness and emotion. This is also in the future which will come up. So based on that, we can compare the types on the basis of capability and functionality. Now, what can be the use of AI while learning or while teaching? There are many pathways which can be developed. So I've divided into two: adaptive learning system and enhanced cognitive skills. So adaptive learning system, that is an AI driven platform tailored educational content to individual students' need, enhance engagement and comparison. That means we can develop a curriculum where we can teach each student according to his performance, the whole subject, and keeping him engaged and comprehension. Like, for example, in anatomy, nowadays we have in anatomy where we do not require a dead body. We have a virtual dead body. We have a table which you can see here, which can be used as a platform. And even you can, if you put up Google glasses or AI glasses, you can actually feel it and see each part of any organ in detail. The second is enhanced cognitive skill. Studies indicate that AI assisted learning strategies improve critical thinking and decision making abilities among medical students. This is a Harvard study which has been done. For example, nowadays, every case scenario can be made into a game, or it is known as gamification. For example, when we were learning, we were supposed to have a patient coming, decide on that patient what is to be done. Nowadays, there are games or there are apparent apps in which one can go into an casualty room. The patient will be brought and he will be showing you exactly the same symptoms of that patient, and the student or the learner has to make decision what is to be done. If an unconscious patient is brought to a casualty, what is to be done? That decision making ability the student has to be done. Now, this has been studied, and Howard has found out that such gamifications of these studies did help the student as compared to in a real scenario. Whereas in a real scenarios, we cannot expect a student making mistake because be it will the life of the patient is dependent there. But here, if a student makes a mistake, it doesn't matter. He can continue, and as it is a game. So this is the difference between enhanced cognitive skills. Also, AI are now becoming personalized learning pathways. Like that means language proficiency support. There are, we know most of us do not have knowledge of English or do not have the knowledge of, even if it is a BHMS student, when he enters into the college, will not be able to understand the terminology. He will be more used to his local language. So getting into the proficiency of the support of the language, AI tool can help here because it can translate every language even on while the lectures are going. For example, recently I can say now Galaxy AI, if you know Galaxy AI has come up. Even my students have started using that during lecture. What they do, they record the lecture, and it is on during the lectures. It is being translated into that language. I'm from Gujarat, so my students during my lecture, if I'm giving in English, they are just listening to it in Gujarati with an ongoing. The translation is going on at the time when I'm taking the lectures. So this will not only help the student understand better, but it will also help the overcome the language barrier which is usually there. Enhance cognitive skills. Students indicated indicate that AI-assisted learning strategies improve critical thinking and decision making. This already I told you that if you have a learning pathway where it can be personalized. For example, if you have to teach a student how to put up a central line, obviously you cannot put on a say a patient. That will be very risky. So usually it is done on the dead bodies. Now, it is not necessary that you do it on a dead body. The students can do it on a gamification. Why using it? If he makes any mistakes, nevertheless, he can go back again and learn in a proper way. And these new generation of students, they have been brought up in a manner that they use the mobile. They are into more gamification. They're more into using of games. So this they have that ability of learning from the game. This enhances their cognitive skills. So this is coming up. There are many websites, there are many apps which can do it, these things. Similarly, we can have virtual patient or stimulation based training. Recently, NCH have started with the CBDC course, and in the new syllabus of the first BHMS, there is a skill lab that one has to have in every college. So in the skill lab, one has to keep all the dummies, and virtual reality is now required to have in a skill lab. So if you have an AI driven simulation, virtual patient powered by AI can be provide a very diagnostic and communication skill. Secondly, this is more cost effective training. Cost effective in the sense when we have virtual patient and stimulation, it means the same patient can be used for hundreds and thousands of patient to the students to learn better. Whereas ultimately, if you have to say when patient comes to him, the student has to wait for the patient and under supervision has to be done. Here, I would say in point of homeopathy, like when we are supposed to teach the case taking to first year student, now it's in syllabus first year, we have to teach the students of first year the case taking. Now, if any company or anybody can come up with a cost effective AI stimulation, and we can show the students how a case taking has to be done in case of acute case, in case of chronic case, in case of say if it is cold coryza or if it is a cancer patient, how it will be case taking has to be done. This can be stimulated. I think right now, as far as my knowledge, no uh, software company has come up, but this is in the pipeline. I am helping a few of the software persons to build up this. If this comes up, then it will be a revolutionary for our students in homeopathy, where they can learn the proper case taking, how is to be done, how to recognize the symptoms, and then to select the medicines from repertorization. Thirdly, immediate feedback mechanism. So when we have a virtual patient or simulation, the student gets immediate feedback. That means if he does any mistake, he will learn from it. But he cannot do that on the patient. And this he learns in the real time. Real time, that means when he's taking a case taking, if he does any mistake, the AI indicates this is where you're going wrong. This is how it should be corrected. So he learns in a better way. Whereas when in a clinical setup, like recent clinical setup, in an OPD setup, if a student is taking a case taking under the supervision of a consultant, the consultant cannot directly tell him that this is where you're making a mistake, because it will affect the case taking also, and also it will affect the patient who is giving the symptoms. So that is not advisable at the time. So usually we take it after the OPD and then we indicate. But this is when we have an immediate feedback mechanism. That is when an AI directly says that this is where you're doing wrong. So that can be corrected. It is easily learned better. So virtual patient stimulation based training has a great importance in teaching uh, clinical skills to the page students. Okay, next is current applications which are in use. Stanford's has a AI, which is VHP, which uses for body scan for risk-free diagnosis practice. You can see the picture here. They have developed this. They use this AI to practice risk-free diagnosis. That means they have a virtual patient who has every diseases, and it teaches the students or the interns how, if this patient comes, how you have to treat, how you have to take the case, and how do you have to diagnose this, and then you have to uh, give the treatment. Next is intelligent tutoring. Now, Carnegie Mellon's adaptive cardiology tutor. This is one app which teaches about specifically about cardiology and cardiac patients, how you have to take the case, how you have to diagnose it, what are the requirements for the investigation, and what you have to do in cases of emergency. These are two which I find out of many current application of AI where are very useful and which can be used even by our homeopathic students. AI stimulation and training. Now, surgical stimulators are already there in BHMS, as now we have started with the skill lab. There we have the use of using mannequins and for stitches and other procedures also. I still remember when I was in my BHMS, I was taught to give stitches on a banana peel, or I did it on a, say, a pillow cover. Now we have dummies or mannequins which can be used for giving these simple stitches, and this helps the students to get it perfected in the skill of giving small stitches very quickly. Similarly, now in surgery, there are touch surgery AI assistant. That means you can do any surgery virtually, and if there is any mistake, that can also be corrected. Even neuroscientists are now being taught through surgical stimulators in many of the countries, because performing on real patient is a high risk. So whatever they have to perform, they do it on a surgical stimulator. Then we performance analysis. AI can identify the techniques gap. That means if a surgeon is doing any mistake, they can identify this is where you went wrong, and then tailor training modules for improvement. That they can create such modules which will help the surgeons to improve their skills. So this is an AI driven simulation and training, which is right now going on even in most of the medical colleges in India. Even AIMS have started this with this training, which is very beneficial and having good results. Now, enhanced learning resources. AI can if give you efficient literature review. That means uh, we have already started with using of chat GPT. Our students have already started. So now when the students have started, my college teachers are bound to start. I mean, we have already started. I'll give you a demonstration of the chat GPT at the end of the session, where you can ask any question and that AI will reply in a mere seconds, which was very difficult when it was a Google time. I mean, when there were times of Googles when we had to Google out everything and more information was not there. But now you can get every answer to every question, and that also with efficiency. AI generated contents. Now you can create contents, like for example, if somebody wants to have an assessment, prepare an assessment, a student is asked to prepare an assessment, he can do it with ease with AI, and create learning more easier. So these are the few things which our students have started using, and looking into that, the teachers have also started using these. Now the issue with AI is this, which has is a very big debate all over the world. Is it is the ethical and practical challenges in AI in medical education. First is the ethical. How far can we take AI, and how far are we ready to accept it? Recently, uh, uh, just yesterday, I was watching a movie. I mean, it's a Mission Impossible, in which the entity, the latest part, it has shown about the AI, the dangers of AI. So this is a big debate on the ethical issues. How far can we allow AI to get into the medical education? AI integration into medication without significant ethical and practical consideration, that will be dangerous. So we have to set boundaries to how much we can get it used and what will be its practical consideration. Now, this will depend upon country to country. Every country has its own ethical and practical challenges. Like in US, there are a few, but in most of the European countries, they have given a go to the ethical use of AI in medical education and even in medical practices. So one of the foremost concern is the data privacy and security. Now that if you look at the data privacy and security, it's not only the medical education or the medical field which is in danger. I guess it is every field where data privacy and security has already there. So that has to be kept in mind. But whatever comes in other fields, it can be used here in medical education and medical field. Training AI system often requires access to large data sets, including patient records and student assessment. Now, if you want to train an AI, for example, how to train a surgeon, he has to have a large data sets, including patient records and students assessment. This can only be provided when we have an ethical law that these data can be used by AI software companies, which again will have to depend upon whether they are going to use the data privacy and the security or not. So it is under debate. Lots of things happening in this. So ensuring that these data sets are not de-identified and securely handled is crucial to prevent breaches of confidentiality. That is a debate which has been going on around the world, and I guess it will continue as long as AI is being used. Nevertheless, we can take what is positive in AI and what is negative, we can keep it aside. And depending upon the rules which our country decides how to get it ethically and how the practical of AI can be used to what extent in medical education and medical practice. Another thing in ethical is we have to have an algorithmic bias and fairness. Uh, I know as we have a PG college, and our students have started using AI to produce their thesis, which is to my saying would not be ethical, but as there are still no laws to it, we cannot do that. So fairness and biasness also is debatable here. So how from where the data is being collected, the real research, I'll come to that point, what is the use of AI in research. So that has to be defined here. Now, resource disparity. For a practical perspective, there are resources disparities between institutions. See, there are disparities between one institution, another institution. They will have their own disparities. Not all medical schools have access to the infrastructure or expertise needed to implement advanced AI system. This is true not only to homeopathy college. I've gone to many medical colleges. I've seen that they are also there are many infrastructures which even the best medical college in India are lacking. This could even widen the gap between well-funded institutions and those with limited resources. Additionally, there is a need for faculty training to ensure educators can effectively integrate and evaluate AI tools in the curriculum. Now, this is another thing we have to update. We, in the sense, the teachers also have to update in this, and there has to be a faculty training program. And as far as my knowledge with the NCH and my connection with the NCH, we are also coming up with this. There will be a program by the NCH for especially for the teachers how to improve and integrate AI in their curriculum. So this is in the future which is happening. So what will be the future outlook and research direction? Looking forward, AI in medical education is poised for significant growth and innovation. We There is no doubt to it, and we cannot stop it. The more trajectory is the development of AI tutor that can provide round the clock personalized feedback and adaptive training pathways. If you remember, in the COVID era, we all went online, all the education went online, and everything was taught there. The teachers who used to take one-to-one classes had to take it online. That was the need of the hour. So definitely AI is going to revolutionize this also. There will be AI, there will be a personalized AI tutor for every student. I'm saying it in the coming few years. In the coming few years, we will not be requiring a one-to-one teacher or a mentor, which is asked by us to keep a mentor on every student. AI mentor will be possible in the coming years. This system could dramatically increase the efficiency of learning and practically in self-paced and remote education settings. So if you're looking at in the future, if you have a one tutor for every student, that will increase the efficiency of learning and teaching also, especially in remote education settings. Two, multi-module AI, where combines visual, textual, and auditory inputs. That means it is an AI where visual, that means videos are used, text are used, and even auditory inputs are being used so that the students are taught proper clinical training are given to them. This can improve not only in knowledge of retention, but also soft skills like communication and empathy. Even empathy can also be increased by these visual and textual and auditory inputs if such programs, and they're on their way. I have seen a few of them. They're on their way and are revolutionizing the education, medical education system. Now, like I was saying regarding this research is also focusing on AI explainability and transparency. That's what I was talking about, transparency. Medical education tools must not only be accurate but also interpretable so that student can understand the reason behind AI suggestion. Additionally, studies are underway to evaluate the long-term impact of AI on clinical competency, ensuring that AI augmentation translates into better health outcomes. So there are studies which are going on that use of or impact of AI on clinical competency. Clinical competency meaning if a student is trained by an AI, how competent he is, and a student who is trained by a say physical teacher in a college, what would be the difference? So initial reports, they say that clinical competency of an AI generated tool is far better than the clinical taken in a college or a clinical skill lab.